After the moldable material is set and you are happy with the teeth position, check the borders to see if the border is too thick. Trim the area thin and remove some extra material with a disc, a knife, or an acrylic burr. The thick border is because you have put too much moldable material and you did not mold the border quick enough. It may have overextension. It may affect the evaluation later. The patient may feel too bulky there. Also check if any border area are short. You can add to the short area with border molding. Use heavy body PVS impression material for additional border molding. For beginner, it may be easier to work on one side at a time. This allows you to focus on one side of PVS impression material without worrying about the material being displaced by the lip at the other side when inserting the tray into the mouth. Seat the tray completely in the mouth. Press hard to make sure the tray is seated correctly and the Easdent teeth remain in the correct position. If the opposing arch is in the mouth, let the patient bite down to centric relation so you can keep the draw relationship you collected. If any border area is little short, you can put additional heavy body impression material there. Press the heavy body PVS impression material against the buccal and the lingual vestibule area and the retromolar pad area and mold the border with various lip and tongue movement again. Remove extra impression material on the teeth. It is easy to miss the hemimelar notch area and distal buccal vestibule area for the maxillary arch and the retromolar pad and the distal lingual vestibule area for mandibular arches. Hemimelar notch area and distal buccal vestibule area are important for the seal and the retention of maxillary complete denture. Distal lingual vestibule are important for mandibular denture retention. Retromolar pad area are important for mandibular ridge stability. You can reload some heavy body impression material and use your finger to push the extra material there, and then mold the border again. If you miss the retromolar pad area due to maxillary posterior teeth biting into the areas, cut maxillary second molar area short to give room for the border molding to catch the retromolar pad area. Add heavy body PVS impression material at the missing retromolar pad area and reseat it back to the mouth. After you press the heavy body PVS impression material in the retromolar pad areas, let the patient bite down and then open to mold the material with functional movement. Then bite down and open again. Do not let the patient stay biting down all the time. Otherwise, the newly added heavy body PVS impression material may stick to the maxillary impression material and set together. You have to separate them later. After the material is set, evaluate the border again. If the previous material is visible through the new PVS material with irregular shape, it may be overextended. Grind away the irregular see-through area. If the border is too thick, use a disc or knife to trim it down to a thickness closer to the thickness of the denture border. This will make sure the tray with the final impression more represent of the denture's shape. The closer the shape of the impression to the shape of the denture, the more likely the impression can function as a tri-indenture to allow better assessment of the patient's aesthetic and function. Now you have an Easdent custom tray with the teeth position and a nice border.